Welcome to another episode of Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. I help patients understand what are their options and how to be able to punch pain in the face, whether it's mental or whether it's physical, and get back to leading the life that they deserve. Today, we are talking about, am I a good candidate for TMS, also known as transcranial magnetic stimulation, and how to be able to improve my results if I am. Today, we're going to talk about the essential questions to determine, are you a candidate for TMS? We'll also give you some methods for how to be able to improve things going forward. So let's get right into it. So how to be able to determine if you're a good candidate for TMS? So one, you need a diagnosis of major depressive disorder. So what does that mean? That means that you need to have been seen by a psychiatrist. You need to have the following symptoms. You need to have had some degree of sad, anxious, or irritable mood that has been lasting in nature, to have lost an interest in pleasure, appetite and weight changes, changes in sleep, some slowing of physical activity or increased restlessness, decreased energy and or fatigue, feelingness of worthlessness and or guilt, poor concentration or indecisiveness, and potentially thoughts of death or suicide. Do you need to have all of these things? No. But if you have some of these things, it allows for that diagnosis to be able to be determined. For those individuals that are looking to different TMS clinics, there are various individuals, including our clinic, that can help you be able to be seen by someone if you haven't seen someone already. But traditionally, you're going to need this diagnosis as one of the criteria. Additionally, you need to have traditional medications have not worked. So for many insurances, they require patients to have failed anywhere from 2 to 4 medications before trying TMS. And the number of medications and the length of the time that you've taken it for is very dependent upon the insurance that you're utilizing. At current time frame, traditionally TMS is used for something that's called treatment-resistant depression. That is depression that traditionally hasn't been responsive to medication. So are there instances of using TMS without having had this as an element? There have been, and they've worked really well. However, if we're looking for traditional insurance coverage, it is one of the things that is typically required. Number 3 is that side effects of antidepressant medications just haven't been able to be tolerated. For many people, they can't tolerate antidepressants, and that number is somewhere around 37.2%. So more than 1 out of 3 patients have a difficulty in dealing with antidepressants. What are some of those side effects, and what are some of the most common ones? Nauseousness, weight gain, dry mouth, dizziness, increases in anxiety, diarrhea or constipation, fatigue, tremors, and increased sweating are some of the most common side effects for antidepressant medications. 4th criteria is age. TMS is currently approved for individuals 18 years and older, and some insurances may limit the provision of TMS to those who are younger than age 70. Now, not every insurance is of that ilk, but some of them are. And then one of the most largest categories is that you don't have a limiting health history. So what are some of the things that can cause there to be an issue with being able to have TMS provided? Or first is if you have metal in and around your head. So things that are going to be like deep brain stimulators, certain electrodes in that area, neck or brain stents, aneurysm clips or coils, potentially pacemakers and defibrillators, though that's not always the case, shrapnel or bullets, facial tattoos with metallic ink, metal plates, cochlear implants, and permanent piercings of the face. In addition, also having a medical history of seizures or a history of head injury and serious neurologic issues can be evaluated at times to see, could this potentially be worsened by TMS, and some insurances won't allow for it to be utilized. So what are some of the ways that you can potentially be able to improve your outcome and be able to get a better result? Well, the ways to be able to improve TMS are a few. The first is to be able to maintain good sleep hygiene, where you're able to acquire 7 to 8 hours of sleep. The second is being alert during the treatment. Those patients who are engaged in conversation during the treatment typically tend to get a better result. Finally, one of the other things to consider is maintaining a healthy lifestyle. So if you're eating a balanced diet, you're staying hydrated, you limit alcohol and caffeine intake, those things can matter and matter for a good number of patients. Staying on schedule and not missing appointments for TMS treatments has been shown to have some degree of impact and improvement. And finally, you don't want to stop your medications that you're currently using, even if they may not be effective though, or have some degree of side effects, and we're trying to be able to limit them. You don't want to make that change until told to do so by a medical provider. So those are some of the ways to be able to assess, are you a candidate, and how to be able to improve your outcomes. If you found this video helpful, hit the like button. If there are questions that you have, please leave them in the comments. And if you're interested in learning about more videos like this, please subscribe to the channel so you can learn more elements of how to be able to know what your options are and how to be able to punch pain in the face, whether it's mental or physical, and how to be able to get back to leading the life you deserve. Thank you so much and have a great day.